Hi team, Jess here. This is a lecture on communication. We've got some pretty clear learning outcomes that I'm hoping that you can achieve out of attending today's session. Understanding the relevance of communication in a treatment room and how it pertains to therapist and client interaction. We're going to have some exposure over the fundamentals of what makes up charisma and how, if you're not very charismatic, how we can actually practice it and train it in our daily lives. And then the other thing that we're going to be doing is reflecting on our communication styles and then strategizing as a team, or if you're watching this video at home by yourself, reflecting and practicing out loud ways that you can improve your communication in the treatment room. So we're going to go over some facts. Now, these facts are super important that this is where we're basing our fundamentals on. Now, fact. Words change how people feel. We know this. There's empirical data on it. And psychological factors are more effective predictors of pain and disability levels than pathoanatomical factors. Now, again, this is scattered through the literature. I have, for those who are skeptics, included really strong reference lists in the slides so that then you can go back and these clickable links, so you can click these later on. Our second fact is communication is rated by patients as the physiotherapist's most important quality. So it's not knowledge, it's not hands-on skills, it's communication and how we get our point across. These are the references that we're using to back up that fact. PS, these are really good systematic reviews, and I would encourage you, if you're interested in the skill of language and communication, read these. Don't just ChatGPT them. And our last fact that we're going through is positive patient-therapist interactions in a physio setting linked, again, empirical research and data, reduced pain, reduced disability, and higher treatment satisfaction. Often what we're saying is if patients know, like, and trust you, they're going to get better quicker. Again, this is all of the references for those facts. So now let's talk about charisma. Now, charisma is made up of two key factors. We know that if you rate well on high warmth, people trust you, you're likable and friendly. And also you combine that with competence. You come from power, you're reliable, and you're capable. Now, if we merge both of these, if we have a look at this graph here, then this is our charismatic zone. Now, too much of warmth or too much of competence is not a good thing. And so that's when we're thinking that often thinking in terms of the worst cases or the most dialed ups of these will help you understand where we want to land within our sweet spot, which is charisma. So too much competence without warmth can come across as intimidating. Let's think of Donald Trump. Might be pointing with his finger. He uses really strong language, really short, clear sentences. Doesn't always make sense, but his delivery is very, very competent. I'd say that if you think about his delivery, then it reduces his competence because he doesn't have clarity of thought. But in terms of his body language, he's always coming across as powerful. So he will shake hands. Instead of coming in for a shake like this, he will shake like this and trying to employ his dominance over people. Now, on the other end of the scale is if you have too much warmth, you will come across as overly friendly and not taken seriously. So this is like people pleasers. A lot of health professionals and females will come into this too much warmth factor. So they might be going, You might not know those friends who you won't really trust their opinion on something. You won't ask it, and you just are assuming that they're going to say yes to all of your whims. So again, this is the too much zone. We don't want too much warmth. We don't want too much competence. We want to be right in that center stage of charismatic and charisma. So we know that clinicians with charisma, we're inferring that from those facts that we saw at the very start of the slide, if people know, like, and trust you, if you build a strong therapeutic alliance, then we're going to reduce disability, reduce pain, and we're also going to improve the client's journey or their outcomes in future. So let's think of these two things we're going to work on, warmth and competence, and think of the things within the sphere of communication that we have to play with. So that can be body language. I'm open to you. I'm using my hands. My gestures are matching my words. What I mean by that is you be highly not trustworthy. If I said, all right, we're now going to talk about 3 points, and I have the number 2, it's actually really hard to do. That is not a trustworthy thing. So we're playing, our body language can either help us or hinder us. Again, body language like this, I'm closed off. We learned this at uni. If the space between my ear and shoulder is reduced, I have low levels of competence and you're probably not going to trust me. I also look disinterested. Other things with body language is where my feet are standing and also our kind of room setup. So if I'm leaning in or if I'm leaning out. Other things we have control over is our vocal variety. That's our speed, our intonation, so how our voice goes up and down, and also volume. There's a few other factors that we can play with vocals, but let's just, for the sake of this presentation, just concentrate on those 3. And then the other thing that we have control on is our content and messaging. So we're going to go through now 5 competence cues where we can learn to either dial up or dial down our competence. Now, the 5 cues that will make you more competent. So if you're a really warm person and a lot of people don't trust you, when you're coming into the treatment room, you have a really good rapport with someone, but you're not very good at rebooking them or having a really clear plan. You might have the clear plan and you might know exactly what's going on, but when it comes to communicating that with the client, they don't really believe you and they often will fob you off. High cancellation rates will often tend to show us lower competence. It's not true competence, but it's what the patient perceives, which is probably more important than actually your skills, which we've seen at the start of these slides. So to increase your competence, our gestures need to match what we're saying. Now, the highest level of competence hand gesture is the steeple. Now, this is not to be confused with like evil fingers or drumming your hands. But if you slow down your speech and use steeple hands, then that will increase your power or the way that clients may perceive your competence in a session. So this is relaxed. I'm poised. I'm also slowing down. So that means my clarity of thought increases. My body language is open. The other things with competence is eye contact. Now, I've got a video in front of me, so I'm making direct contact with the camera. But we know if you're in person, it's actually creepy if you have too much eye contact. We know the magic number is around 60 to 70%. But the most important thing with eye contact is making it at the end of the sentence. So if I'm talking to you about this and we go on to our next point, which is a lower lid flex, which might be something like a squint, where I'm trying to really understand. If I do that and then I look directly into someone's eyes at the end of the sentence, it's like a full stop or an exclamation point. So I'm really hammering home on that point. Our next one is a lower lid flex. So this is what I call like blue steel. You think of male magazines. A lot of the models there will have that squinty eye and a head tilt. I'm not very good at it, but that is dialing up competence. Now, you might have been in meetings where someone goes, So they've got a thinker's pose. Their gestures is matching their body language, and they're also really trying to understand your point. That will increase your competence. If you do that too much, it can become intimidating and you can look disgruntled. So just make sure there's not too much of any of these cues. And again, as we spoke to at the top of this slide, using your vocal cords, slowing down your speech, using pauses to really nail different points. So that I employed a few of those there. And then the biggest one that I was really curious to find out and learn about is bringing your tone or your intonation down at the end of the sentence. An example of someone who does this really well is Barack Obama. He will talk in a way that really hammers home each point. And you can hear him go down. An example of someone who increases their tone or intonation at the end of the sentence, it's kind of like it's an accidental ask. So if you have a little kid, maybe a 3-year-old, you say, "Did you steal the last cookie?" And they go, "No." You can hear that go up and they automatically become less believable. You lose trust in them automatically. So these are our competence cues. Now, this is where we get to pause the video and have a little bit of a play. I want you to reflect, thinking about where you land on this scale, and practice some of these competence cues. Now, we're going to use one clear clinical setting. Right now, we've been having a lot of bone builders come through the clinic. So I would like you to give a 1 to 2 minute spiel of why a lady who's postmenopausal should be doing strength and exercises to increase her bone density. And I just want you to use competence cues. Okay, so an example might be, if you don't start doing strength training for your bone health, you will increase your risk of fractures, have low bone density for the rest of your life, and have an over-reliance on medication. Is that something that you want? That's a highly competent, highly assertive, often powerful type of example. It's not one that I'm recommending we employ in a clinic, but that's an example of how we can use competence with that type of communication style. Okay, let's move now into the warmth category. Now, we know warmth is probably more important in our clinical setting because people want to be cared for and know, like, and trust us. And generally, warmth cues is really where we want to dial it up. For females, it's naturally, we can come across as warmer because we generally, now this is not taking away from the blokes in the room, but generally we might be a little bit more externally emotionally intuitive, just in terms of the way our brain's wired. So warmth cues, if you find that you are scaling more into the competent zone, these 5 things can really help dial up how warm you are. Now, again, often if you like someone, you will automatically come across as warm. So these are things that you can do even if you don't like your clients. So first one is a nod, again, body language. This is a triple nod, and it might be something like this. 3, if I do it too fast, I'm rushing them, so I'm really trying to ask them to shut up. So that would look like something like, So I'm doing that with a blue steel, and I'm also like, come on, just wrap, just finish up with that sentence. So when a client discloses something, it might be, yeah, okay, tell me more. So I'm matching my gestures with my voice. I'm showing competence, but I'm also showing warmth at the same time. If you are too warm and you always find yourself nodding really vigorously, try a head tilt. This will increase your warmth. It'll show you're empathetic and you're caring, but it'll stop you from being an over people pleaser. So it might look like something like, this is where we can measure competence and warmth together. So, that's interesting. I used a pause. I used a head tilt, but I also use those squinty eyes. So then I'm competent, but also warm at the same time. Other ways that we can dial up warmth is our authentic smile. Now, this is a well-researched type of smile. It's called a Duchenne smile. So it's like smiling with your eyes. Don't be creepy and just smile with your mouth. All creepy smiles. You want to smile with your eyes. So you got a crinkle in your eye. Your cheeks are activated and you're generally showing your teeth. It's not a general, you're not bearing down with the bottom of your lip. My lip muscles go up, and my our TMJ therapist will know which muscles are activated, but I'm getting my masseter activated as well. Other 2 cues for warmth is open palms, knowing where my palms sit. So it might be at the start of the consult. Hi, I'm Jess. We're going to be working this way. Come on down. So I'm showing my palms at all times. Now, it's not like this, like I don't know. I'm also leaning forward. Now, I don't need to lean forward the whole conversation, but I might lean forward and say, oh, that's interesting, as an exclamation point. So even if I stand there, lean forward the whole time, It's often too much of a good thing. It's overly too warm, so I can come in and out of those proximal zones of intimacy. So what I'm talking about there is that our best way or spacing for conversation is a place where we can both touch each other if we reach our hands out, versus if I'm too close to you, this is coming into your intimate zone and it's too much. What we want is optimal settings, and we'll set up our rooms like this. It's just enough that if both of us reach out, we can touch each other, but we've also got our own space. Now, to increase warmth, we can also touch more. Now, I'm really careful not to include these too much in the slides because we don't know where our clients have come from when they're coming into a session with us in terms of like past trauma. But you can imply a touch. So it might be a lean forward. Oh, tell me more. And I'm reaching forward, but I'm not touching them. So it's like an implied touch. We have the gift as physios, massage therapists, and EPs that we actually do a lot of touch naturally. So again, our warmth can be dialed up there. So this is our warmth cues for body language, our smile. We're now going to have a little practice. I want you to say the same sentence to that lady who needs to increase her bone density, but try it in a really warm way. So an example of too much warmth, again, we're going to the extreme so that then we can find that sweet spot in the middle, might be something like this. Oh, so you know that if you increase your bone density with strength training, then you'll be really good at building bone strength. You'll be able to play with your kids and you'll also reduce your fractures. How does that sound? Again, I am not deliberately not showing a lot of confidence, but I'm showing lots of warmth. My speech rate went up. Leant forward, lots of head nodding, and also to my content of what I'm talking about is often much more personable, matching what the client's goals or needs are. So how do we get it right? What I'm thinking in terms of, or what we should be thinking in terms of in the clinic room is connection and clarity. If we can get both of those two things, connection is essentially our warmth, and clarity is essentially our competence. So how do we connect with our clients, especially when we don't really like them? Again, we know that you will naturally connect more with people that you like. You'll be able to mirror their body language more. You'll have the same vocal variety, and you will also generally have the same language components. So farmer comes in, you will naturally start to talk, yeah, nah, like a farmer, which will increase your connection. If you do it too much, be mindful that will lower your competence, but it's still a tool that you can lean on if you need to. So what you can do is mirror their body language at the start. If someone comes in and I'm a very loud person, takes up a lot of space, they might come in and say, oh, Jess, I was really nervous to come. Closed body language, really low voice. I might say something like, to mirror them, to start the conversation, yeah, gosh, seeing a physio can be really scary, especially if you've had bad experiences in the past. Why don't you tell me more? So I started there, but then I increased my volume and created more space, which is a bit more assertive, to help drag them into the conversation, to have the confidence to come with me. So you mirror at the start, but then take them to where you want to go because you are the therapist in the session. Other ways that we can create connection in our subjective, having something really simple written down. Last time we talked, you mentioned this. Really good way to dial it up. If they come across as a weird belief, use your pause, maybe a head tilt, maybe a thinker's position, maybe a lean forward. Gosh, that's interesting. Tell me more. So I'm using it as an exclamation point to dig. The quickest way to create real connection is just to get curious. So these are one-liners that you can use or think about when you're in with a client. Who are you actually talking to? So if you saw me right now, I'm postpartum female, I might come across as, hey, still really assertive, but maybe you're talking to a mum who's super sleep deprived and hasn't eaten all day. So really thinking not just at the person who's coming to present to you, but also the actual person that you're talking to. The other thing I'd always want you to think about is when you are communicating with someone is who else is in the room with the client. Is it their GP, their sister who's had an ankle that's never really healed, their co-worker who's still on workers' comp and can't get back to their job that they love. So who else is in the room? So what other of their things or people have they got playing in their head that might be different to your messaging? And things that you can use, or what sentences that you can use to get more curious, is what makes it hard right now for you? Or what are you worried about what might happen? Once you ask the question, pause. Use your lean in, use your head tilt so that you're increasing your warmth and increasing that trust so you can really get to the really secret sauce of where you're going to shift the needle in terms of therapeutic alliance. We connect, and then we also have clarity. The way that you can build clarity in your sessions is to use a conversational breath. Now, this is a really fancy way of just saying a pause. If you have lots of filler words when you talk to someone, but just like, so I really think that you need to do your exercises because, if you don't, then you're not going to be strong later and you'll also have an increased risk of falls. Lots of filler words. It dilutes what we're actually trying to get out or get the message across. I can still have a high level of knowledge, but I sound like an idiot. So remove as many filler words as you can. If you do have a tendency to fill a conversation with filler words, just practice over the next week, the next 2 weeks, pausing instead of having the filler words. The next one to increase your clarity is if you are a really fast talker and a fast thinker, and this is something that I really resonate with as well, is finish the point before hopping to the next point. So someone who doesn't finish the point, it might be, hey, I really think you should increase your brain strength. You did mention that you were going away on holidays, but I do want you to get to the gym a few times because... And then you're hopping from one thing to the other. So that person has to kind of catch you where you're at. But often what will happen is they'll just zone out. We've talked about removing filler words. And then what I really like is things that you can practice, which are called declarative statements. Now, this is in the literature of psychology and communication. But when it comes to physio, what we can say is, and we often do this quite well, especially senior clinicians, the literature supports... That's if they've got a high level of education. We know that if you build your bone strength or do 2 strength sessions a week, the Liftmore studies showed us that over 8 months, your bone density increased and so did your risk of fractures. So I'm leaning on science, evidence, something that's going to give me confidence, especially if I don't have a lot of experience. Another declarative statement could be something like, well, I've been a physio for 15 years. And we know that from all the clients that we've seen, women love coming to these classes and men. And often there's a really nice community that's been built. That's something that we've seen and been lucky to be a part of with the Bone Builder program. So again, still declarative statements. We're not using evidence, but we're using our experience. So there's a few ways that you can add it. In terms of clarity, this comes when you really know your content and you're really confident. If you're not confident, you don't need to fake it. You can just explain that and come and be vulnerable with your client. So you can still be really clear of thought, but not have all the answers. So for example, someone asks you, they might have non-specific low back pain, and they say, well, what's causing my pain? To be honest, we actually don't know the very single structure that's causing your pain. When we think about non-specific low back pain, it's actually not a very nice term that might resonate with you and can make you actually feel quite not great. So you don't really feel heard or validated, and also can come away with more questions than what you came in with. What we do know is that there is more than one way to skin a cat. And so that with pain is super complex and it's created with lots of different factors. Now, sometimes this means that we can choose 1 or 2 factors to play with, have a go and experiment together to see then which factor is the best factor that we aim for with you with this condition. That was a bit long-winded. Probably need to practice my declarative statements. But again, practice improves this because it is a skill. So now I want you to practice with using that same example of a lady who's coming in to find out if she's osteoporotic and finding out that she needs to do strength training. We're trying to do warmth and competence, and I want you to have a little play of that. So, for example, that might be something like this. We know that if you do 2 times a week strength training, bone loading, which includes jumping, hopping, landing, as well as some balance exercises, you can improve your bone density and even get better outcomes on your DEXA scan. We also know that we don't always do exercises at home, and we are better to do it better to exercise in a community because we get those social benefits. We have 2 classes a week, and you've got to pick in terms of your timetable, and I can help you with that if that's something you're interested in. They're run by an exercise physiologist and a physio, and we know that if you're doing it as a group in a community, you're more likely to attend, and you're more likely then to get these better results as you go. My intonation went down. It took me a few practices off screen to not ask the question at the end of that statement. But that's an example of a charismatic zone. Again, I probably need to practice as well. Where does this fit in terms of the clinical application? We're going to go further in this in future sessions, but I want you to think of in terms of when do I apply warmth, when do I apply competence, when do I connect, and when do I have clarity. Think of your session as a start, middle, and end. At the very start, we generally want high warmth, lots of connection, listen, validate, do all the things, the warm and fuzzies, really dig in terms of your subjective. In the middle of the consult, do 1 or 2 manual therapy things. Do 1 targeted exercise. Do not overcomplicate it because you will lose that connection and you will lose clarity at the same time if you're throwing shit at a wall and trying to see what sticks. And then at the end of the session, ensure with practice that you've got that time for the wrap. And this is when you really want to dial up your clarity and your competence. Have a really clear plan. Remove your filler words. Be therapist-led. So I'm leading. My intonation's going down. I'm telling. I'm not asking. Does that sound... you need to do 2 strength sessions a week. You need to do 2 strength sessions a week. Less is more. So if you start to think you're over-explaining and you're losing them, then you can use a disruptive hand gesture. And now that could be something like, oh, I'm sorry. So I'm waving my hands in front of my face, or I'm crossing my arms over, and then I'm finishing with my palms facing down. So that's a really powerful position where my hands are just below my chest and they're just facing down. So if I've lost them in this session, I might say, oh, I've lost you there. I'm sorry. Let's choose another analogy. Please let me know if you have any questions. So that's an example. Now, super curious. If you have any questions, please jot them down. Slack your mentor, whoever is taking you through this stuff. And then before you finish this exercise, complete the feedback form. This will increase your retention of the session. It'll also encourage you to start to personalize this so you can really dial in to know where you are in terms of that communication scale and then what you're going to take away in terms of the clinic room.